Congratulations to all the people who have made a contribution. Thank you.
Welcome to dialysis unit. It's a 11-bed capacity.
Okay.
So, maternity is what is capacity.
Habari zenu? Asante sana. Asante sana. Okay, asante sana. Naitwa nani wewe?
Naitwa Elsa.
Elsa. Okay. Asante sana. Very good.
Yes.
Okay. Very good. Asante sana. How are you, boss? Asante sana. Okay. Congratulations.
It gives me great pleasure on behalf of the AAR Group to welcome Your Excellency to today's official opening. Also for the City of Nairobi and the environment for investors and fruitful collaboration with development partners. Opposite Karura Forest, an area that 0.5 billion shillings, and it started receiving patients in 2021. The renal unit has 11 beds with the capacity to that was made possible by our investors, all of whom are keen, which the realization of the Finance Corporation of the World Bank Group, the International Fund, is this project. Your Excellency, in fact, we are committed to putting up additional modern hospitals and clinics in various parts of the country. And kindly allow me to now welcome one of our partners, the Swedish Ambassador, Caroline Vichy.
European countries, France, Denmark, Finland and Sweden that contributed to the construction of the AAR have worked very closely together across Africa and services and enhancing technology. Marika, who is a Kenyan of Polish descent, under the name Africa Air when she is an elderly person. So going back to in 2019, resources, because there were only 3% of the global health workers. This investment contributes towards the SDG 3.
State Department Medical Services, Engineer Peter Tum, to come and
health and professional development, our regional commissioner, all protocols observed. This your very important schedule, very, very important facility. We want to congratulate you, Your Excellency.
Please, let's take our seats. Thank you very much. Thank you very much, PS2. Milestone that opens a new chapter in your strategy.
ceremonial cake cut.
On behalf of the Ministry of Health, on behalf of the health sector at large, we want to congratulate you, Your Excellency, for the direction and vision you've given this country insofar as working towards providing universal health coverage is concerned. Your Excellency, you've encouraged us to work together, the private sector, the faith-based organizations, and us as government, to be able to give that very elusive universal health care program. And I would wish to take this opportunity to thank this specific hospital, Your Excellency, which has come up with a level 4 facility in Nairobi that I'm sure will cater for the healthcare services or coverage in this region. I am told that they have 21 facilities around the country, and Your Excellency, in your direction of providing primary healthcare services, they have not also been left behind because they have a referral mechanism that they use in those 21 facilities.
France, Denmark, Finland, and Sweden, and our respective development finance institutions that have contributed to the construction of the AAR hospital. All our governments have long-standing relationships with Kenya and East Africa, cooperating on several sectors, including healthcare, but also agriculture and financial inclusion. Over the years, these 4 European development finance institutions have worked very closely together across Africa and across other continents to provide development capital to support key sectors, to spur sustainable economic development by supporting enterprises that contribute to nation building through tax remittance, decent job creation, provision of quality goods and services, and enhancing technological and capacity and knowledge. This investment contributes towards the SDG 3, ensuring healthy life and promoting well-being for all by enhancing access to quality healthcare services, working alongside other healthcare actors in East Africa healthcare system. In many developing countries, a substantial increase in health financing and recruitment, development, and training and retention of the health workforce must be achieved for a universal healthcare coverage to be achieved. We remain committed, and I speak for all 4 of us, to working in East Africa and the wider Africa to provide capital, knowledge, and technical assistance to support sectors that turn these economies to grow and become more resilient.
Healthcare is not just important, it is fundamental. It forms one of the cardinal pillars of our radical bottom-up transformation agenda. The people's fundamental right to healthcare constitutes a vital component of our governing mandate, and it is important to use such an opportunity as this to lay emphasis on this particular subject. Secondly, universal health care, which makes medical treatment a public good, is a means of increasing the disposable income available to Kenyan households. By drastically minimizing expenditure on health needs, Kenyans will have more savings to invest in goods that enhance well-being and grow their wealth. This is how a thriving economy is built sustainably from the bottom up. It is also in order for me to adequately speak to the subject of the broad spectrum of health needs and serve diverse needs of patients from various socioeconomic backgrounds. Our healthcare ecosystem must itself process a rich mix of varied service providers. And I want to welcome the AAR team into the space and the ecosystem of provision of hospital facilities in our country. This is going to be a continuous collaboration between public and private. It is with clarity that I believe the best way to, the most efficient way of delivering on our health objective is to create a seamless partnership between the private sector and the public sector and be able to dissect what best can be done by the private and what best can be done by the public sector and everything in between.
We currently serve over 200 patients a day and employ 180 people full-time. At full capacity, we expect to serve more than 400 patients a day and will have more than 300 members of staff. Your Excellency, the dream of having this hospital was made possible by our investors, all of whom are keen to play a significant role in supporting the government of Kenya's development agenda for healthcare, for which the realization of universal health coverage is a key pillar. These investors are the International Finance Corporation of the World Bank Group, the International Fund for Health in Africa from the Netherlands, Sweden, Finland, Denmark, and Propaco from France. The investment is managed through Hospital Holdings Investments, a company duly registered in Kenya, whose mission is to expand healthcare in Eastern Africa. We are extremely privileged to have the aforementioned partners with us to realize this project. Your Excellency, this new hospital serves the whole of Nairobi and is part of our larger AR healthcare network, which was founded in 1984 and which provides quality service to the populations of Eastern Africa. Your Excellency, the population of the city of Nairobi and surrounding counties has grown exponentially over the years, outstripping the provision of health services and placing a heavy burden on the government health facilities. We are pleased that the new hospital will play a crucial role in helping the government in its efforts to offer high quality and affordable health care to all citizens. Indeed, we believe there is room for more investments of this nature in the health sector. Your Excellency, as a team, we assure you and your government of our firm commitment to the health and well-being of our communities, and we hope to play an increasingly significant role in the expansion and access to quality and affordable healthcare in our country. In fact, we are committed to putting up additional modern hospitals and clinics in various parts of the country and throughout Eastern Africa in the coming years. We look forward to the cooperation of the government in enabling us to achieve this vision of creating a network of top-notch hospitals in Kenya and beyond.
Our reform of the Kenya Medical Supplies Agency is well underway. We want to make it a fit-for-purpose vehicle for delivering our medical supplies in a competitive, cost-effective, and timely manner. Equally significant is the government's resolute decision to establish and to promote local manufacturing capacity for healthcare products, together with the acquisition of the necessary technologies to make sure that Kenya meets a significant proportion of its requirements through local production. These reforms will be accompanied with complementary efforts to make the National Hospital Insurance Fund a strategic purchaser of healthcare services. And again, we are working the numbers. My team is working with the Ministry of Health to make sure that we have an essential package for every condition and for every item that we need in that space. And in the next coming days, we will be informing the public on which direction we are going, because universal health care is a must deliver this time round. We've made several attempts. The Grand Coalition government made an attempt on universal health care, and we didn't succeed. The Jubilee administration made an attempt on universal health care. It didn't work. We are not going to fail a third time. So I have told my team. This time round, we must get it right, and it must be from the bottom going up, because we believe that the most efficient, the most effective way of dealing with healthcare is at the bottom, where we are working with community health volunteers and workers. And just this weekend, we sat down with all our governors, and we have agreed as a whole of government approach that our first intervention is to make sure that the 100,000 community health workers across Kenya will now be hired by both the national and county governments to provide the first line of response and the first line of contact between the healthcare system and the citizens of Kenya. We will agree to build it up continuously. We have agreed to ensure that all the health workers are trained seamlessly and they are capacitated in the same manner so that we do not have gaps and we do not have sectors that are doing different things from the others.